Hi, Dr. David Cull here. So I had a really great question today. I finally found one space in my YouTube app, Studio app, to answer all the comments and questions. And this is a great question for you, those of you that suffer from costochondritis or hiatal hernias, acid reflux. Anti-anxiety medication cause costochondritis? Legitimate question. First of all, if you're taking anti-anxiety medication, you have some sort of anxiety, right? So the question is, what was your anxiety like before you developed chest pain and costochondritis, or what you think is costochondritis? And I'm going to make a connection for some of you guys that might shock you. So you need to think of that first, right? What came first? Now, if they came around the same time, yes, anti-anxiety medications have some side effects like musculoskeletal, muscular side effects, muscle pain, muscle spasms. I think if you just have to look at the drug that you're on. I mean, there's so many out there, I couldn't possibly know, but there are side effects. But more likely, what's happened is you think the costochondritis was caused by the acid reflux. It's probably the other way around, that the costochondritis caused the anxiety. And I'm going to explain why. Why do you have anxiety? Well, you have to go back to the vagus nerve, okay? Vagus nerve, vagus nerve, vagus nerve. Please check out my videos. I've done so many videos on the vagus nerve. A to Z on the vagus nerve. You go back to the vagus nerve. The vagus nerve controls your heart rate variability, and it does create panic attacks for people. So how does costochondritis relate to, or chest pain relate to anxiety and stress? Well, first of all, the pain, especially if it's on the left side of your heart, the heart side, and you're having that, you think you're having a heart attack, so you keep going to the cardiologist. Yeah, that's going to cause anxiety for anybody. Everybody has anxiety. Even I have anxiety. But I get it. You're on medication. It's next level anxiety, panic attacks even for some people. So that's different, right? So first of all, do you really need the medication? Does it help? I think you need to ask yourself that. Then second thing, the costochondritis. I ask you guys, if you think you have costochondritis, first of all, what makes you think that? Who gave you that diagnosis? There's no test that diagnoses costochondritis. None, nothing, no test. So that's frustrating, I get it. But I will say this, there's another condition that mimics costochondritis and panic attacks and heart palpitations, okay? So, and anxiety, all three of those things, and that's entrapment of the vagus nerve. So your vagus nerve, let's go back to the vagus nerve again. So if you have acid reflux and GERD and heartburn or chronic postnasal drip or like a pit in your throat, or food is hard to swallow or bloating, feel full after you eat a few bites, any of those symptoms, difficulty getting a full breath in, any of those symptoms, chronic cough, LPR or silent reflux, those symptoms with chest pain, then most likely it's not costochondritis, it's a hiatal hernia mimicking costochondritis. And now you're on medication to solve that, which is just a cat chasing its tail, right? So now let's travel with the vagus nerve. This is a huge video, so I hope you guys are getting something from this. If you're not, I don't know how else to help you. Vagus nerve starts up, it's a cranial nerve, a 10th cranial nerve. So that nerve is going to travel all the way down. So it starts right up here and it travels all the way down. And then when it gets through here, it wraps around the heart. And the left vagus nerve wraps around the anterior arch of the aorta, and around the right one around the trachea and the bronchial, the lungs, okay? And then down here, just above the diaphragm, right as it meets the esophagus and diaphragm here, right there, it starts to wrap around the esophagus. And then it runs through the esophageal hiatus in the diaphragm, which is where a hiatal hernia herniates. So when you have a hole this big, and now you have your stomach coming through, and then there's also supposed to be two vagus nerves there, now you're putting pressure on that vagus nerve, and that can inhibit the vagus nerve or excite the vagus nerve. And that can do a lot of things, because the vagus nerve does what? Who can guess? I know you guys all know. All my subscribers, I know you know what the vagus nerve does. Vagus nerve controls heart rate variability. Boom. Controls acid production. Literally, acid production. Okay? It triggers the parietal cells. We won't get into all that geeky stuff, right? Third, it controls the motor control of the sphincter, which is the trap door that keeps the acid in the stomach. Again, it's like a cat chasing itself. You have to correct the hiatal hernia. So some of you may think you have costochondritis, and again, no test for that. I mean, but I'm not saying you don't have it. Some people have that with hiatal hernia, but check. If you have all those other hiatal hernia symptoms, you probably have a hiatal hernia, and that may be causing all of your anxiety issues, and you can get off that damn medication. There's one way to pull that stomach down. It's an osteopathic technique called the Hiatal Hernia Maneuver. Okay, we do it in person, and I also created my patented device called the Reflux Shield, which mimics what I do in the office. You can watch, we've done all sorts of videos. It shows that. You can go to refluxshield.com. It explains it. It's a simple, safe massage technique over the stomach, resetting the phrenoesophageal ligament. Again, I'm not going to get too geeky, and pulls the stomach down, taking pressure off of the vagus nerve and getting you off the medication. And your doctor will never tell you about this. So I hope this helps you. And if you want to learn more, subscribe. We have awesome videos on costochondritis, hiatal hernia, reviews of products, stretches for sciatica, neck pain, exercises, you name it. Check out our playlist. Thanks for tuning in. See you soon. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.